Today we are joined with Dr. Jim Bradley, who is clinical professor of orthopedics at the University of Pittsburgh Medical Center and head team physician for the Pittsburgh Steelers. And today we're going to be talking about JumpStart Advanced Microcurrent Technology. So Jim, what got you initially interested in JumpStart?
So as you know, we have a problem with MRSA in football locker rooms and wrestling mats and certain things. And we were looking for an effective way to treat it without giving them drugs or salves or things like that. And we came across this technology that was presented to us that's advanced microcurrent technology, which is electrical current that kills bacteria. And because of that, we can apply a bandage to the area, protect the athlete, cover it, and it's been very helpful in our hands.
What do you see as the advantage of JumpStart over traditional silver dressings?
Well, traditional silver dressings, as you know, there's a containment problem as you put it on. Plus there's microtoxicity that can be absorbed into your bloodstream. And we don't know all the effects, but surely a system in which you have none of that, none of those worries, like the microcurrent technology that you are presented us with, is a much better alternative than to even risk those adverse effects.
So Jim, is it really a big deal when someone gets an infection?
It's a disaster. I mean, if you get an infection in a total joint, I mean, it'll change the patient's life. And as we know, certain organisms like to, live in the axilla of the arm, for example. Let's talk about total shoulders. So P. acnes is an organism. It's kind of an insidious organism that kind of lies there. And if you get an infection like that in a total shoulder, it truly changes the patient's life. So if you have a system by which a simple post-operative dressing that's inexpensive and effective, then I would say to you that you are almost encouraged to do that. And the overall cost of it, for the whole patient experience is minimal compared to the cost of one infection. So literally you could, with these bandages, if you could prevent one infection, you basically have saved the system a significant amount of money.
About the dressing itself, is it difficult to apply? Could you talk about the application of the dressing on the patients?
Well, you have two potential choices. You can take the dressing as it is here, which is very pliable. You can move it. It comes in larger sheets, and you could customize it. The one thing you have to do, though, is when you can lay it down, you can use it with steri-strips. You can use it with bio-occlusives. And when you lie it down, it has to be moist. So you can either use hydrogel, saline, possibly ACP, and then you need to cover, or the tissue's own exudate. That'd be possible. Then you need to cover it and keep it moist, because to keep the current going, it has to be moist. Or what you can do, and more what I do, is there's different sizes, as you can see here. So this would be a total shoulder one. This would be like for a total knee. This would be for arthroscopy. And they're built in such a way that there's a foam pads in them. So the foam pads that are under the dressing will wick up the moisture, and it'll keep it there for a long period of time. So, for example, you'd put it on simply like that, and you'd have that moistened, or you'd let the exudate come up through it. And I want to make this a point. Now, you can use these with steri-strips and with that skin adhesive. It works in that manner. And what it does is really, it causes the re-epithelialization of the skin. So the normal skin has an electric current. And what you're doing is you're reestablishing that electric current to improve the healing of the wound.
And I know you and I, Jim, have taken a voltmeter to it before. And can you discuss our findings and what we found when we actually took a voltmeter to it? When
you touch the silver and the zinc, what you'll get a current of 0.7 to 1 volt in the skin, and that's optimal for healing.
Which it reestablishes the normal microcurrents of the skin.
Correct.
As you know, superficial infections are a real problem in orthopedics, but even more concerning are deep infections. As you know, in the shoulder, especially P. acnes. Now, what other organisms have you seen in your practice that are a big concern?
Well, the ones I particularly worry about are Pseudomonas, Serratia, MRSA, P. acnes, as you mentioned. And this microcurrent technology actually affects and kills all of those in multiple studies. And we'll have a list of things that it kills, but there are certain resistant ones you really worry about, and it attacks, MRSA, vancomycin resistant staph, and things like that. And for the cost of a bandage, to prevent those, and for patient care, I think this is a big plus.
Have you noticed any other advantages in your practice with the JumpStart?
Well, really, we did a study. So what we decided to do was, well, let's see how well it re-epithelializes the skin, because you know the current is going to make the epithelium improve its environment. So we actually did half the patients without it and half the patients with it, with some steri strips in between, and making sure it was wet and covered, and we kept it on a week. And we found that the wounds looked better and they were more cosmetic. So the young ladies that you do an ACL on, or the you know, people that worry about scars, their skin looks better in our study. And this was all with a photograph. You know, we took photographs before and after of each group.
Now you think so, the concern would be, well, maybe I should just be using this for open surgery and not arthroscopic surgery. Do you think there's an advantage to arthroscopic surgery?
Well, yes, I do, because one arthroscopic infection, even though they're rare, one arthroscopic infection is really a significant life changer for that patient. But more importantly, let's look at the overall economic system. If you can prevent one, you've basically paid for these for 2 years, just one. So I would say to you, it makes economic sense for large systems to at least explore the use of this to prevent infections.
What about JumpStart and biofilms?
Well, that's a very interesting question, because as you know, biofilms are very common in total joints, and you want to avoid them at all costs. You know, organisms like Klebsiella, Pseudomonas, Serratia, Staph, MRSA, all those things can cause it, and this technology prevents those. And in the lab has shown that it will attack them and it will make the wound clean. So I would say that if you're doing total joints, this is it's beneficial to have another line of defense against anything that's going to cause a biofilm.
Yeah, and there's been a lot of research at major institutions researching all these benefits, including infection and wound healing, and improving cosmesis, including our own Department of Defense.
That's correct. So you can go from the weekend warrior to the professional athlete, but more importantly, the devastating wounds of you know, our wounded warriors, and this has been beneficial in those. And there's studies out there that show it's beneficial to that, you know, a large group of people in our military that have you know, significant wounds.
If you're talking to another surgeon, then what do you tell them about what you use for your postoperative protocols for decreasing infection?
So I talk to them about optimizing their outcomes. So I say, well, what do you want? You want to reduce risk of infection, you want to promote healing, and you want to provide an optimal environment for wound healing. Well, I think we've made a case that this microcurrent technology, without the use of drugs, actually does that.
So Jim, anything else?
Well, I think there's 3 major points in my mind. It's easy to apply, it's cost effective, and it's proven scientifically.
Thank you once again for joining us today. So I think we've made a strong case that JumpStart is inspired by the body, powered by electricity, and energized by results.